Now, any discussion of a Bachelor of European Public Health begins, in fact, with the question of what is public health after all? Public health has been defined in many ways. This definition from McEwen and colleagues is one of the more famous definitions, defining public health as a constellation of disciplines with a common mission. And that common mission is the fulfillment of society's interest in assuring conditions in which people can be healthy. Now, there are a couple of key aspects to this definition that help us understand what public health is. The first is that public health is a multidisciplinary endeavor oriented toward promoting the health of larger populations. So as we're in the medical context, we're dealing with one patient and the factors that are influencing the health of that patient generally at one point in their life over the course of a longer period in the case of chronic disease. In public health, we are dealing with factors that are inherently determining the health of more than one person at a given time, and often over longer periods. And that's why McEwen and colleagues here also emphasize the word conditions, because in public health we're interested in the conditions that either enable us to be healthy or inhibit us from being healthy. We then come to the question, well, what determines health? This model is one of many models showing a wide range of determinants of health. This model is from Dahlgren and Whitehead and is used often in public health theory and planning. And we can see here that in the model that Dahlgren and Whitehead move from the biological factors such as age, sex, and heredity up through the lifestyle factors like smoking, diet, exercise, into communities and social networks, which we know are so important for our health, and finally into those larger conditions like working conditions, air quality, water quality, living conditions, the safety of our neighborhoods, etc., that are so important for our health status. I remember that my brother said to me at one point when I got my PhD in public health, he said, "Matt, you got your PhD in public health, now what do I need to do to be healthy?" And I said, "Well, John, 1, don't smoke, and 2, don't be poor, because each of those factors will in fact cost you 10 years of your life based on our statistical knowledge." Now, obviously, we don't soon choose to be poor, and so I meant that facetiously, but a large portion of our population is living in conditions which are strongly limiting their ability to have a long life expectancy, and smoking as well is a very powerful factor.